Qsymia, which combines two medications, phentermine and topiramate, is often used for weight loss, but it can sometimes affect mood. Some people taking Qsymia have reported feeling more anxious or depressed. For instance, anxiety occurred in about 5% of patients on the lower dose and 8% on the higher dose. Mood issues like depression were reported in about 4% on the lower dose and 8% on the higher dose versus 3.4% with no treatment. These mood-related side effects happened in both people who already had depression and those who never had mood problems before. That means even if someone has no mental health history, Qsymia might still cause new issues. The higher the dose, the more likely these side effects are to show up. Also, the medicine's ingredients, especially phentermine, can make people feel more tense or restless, which may explain the increase in anxiety for some. Because of these risks, anyone taking Qsymia should closely be watched for any mood changes. If symptoms like depression or anxiety becomes more noticeable or don't go away, doctors might lower the dose or stop the medication altogether. And if someone starts having thoughts of hurting themselves, the medication should be stopped immediately and permanently. These mood effects were serious enough that European health officials decided not to approve the drug. For people already taking Qsymia, it's important to pay attention to how they are feeling emotionally. Mild mood changes that are short-lived might be okay to monitor, especially if the person is aware and communicates openly with their doctor. But if the symptoms are stronger or lasting longer, it's safe to consider adjusting the dose or stopping the medication altogether to prevent more serious problems. While tools like PHQ-9 or G87 surveys aren't officially required, they can still help track symptoms more consistently. Ultimately, it's less about the exact tool and more about staying in regular communication with healthcare provider. That way, any emotional side effects can be caught early and managed before they become more serious.